everybody understand that the primary control for porcine circovirus type 2, PCV2, is vaccination of pigs around the age of weaning with PCV2 vaccines. This is clear, but also we understand that we need to work with other tools. Vaccination compliance, that will be the most important, other management tool, in the final room, in the finisher, and also at this point it's very clear that this is not only piglet vaccination. We have reached the point where whole hair approach for PCV2 control is here, like other diseases. Gill vaccination, we understand it's important, and also we understand in some cases, some very specific cases, sow hair mass vaccination will not be necessary. So at this point we are in this part of the evolution of the PCV2 control prevention. On the other hand, at this point, this is very current, there is a very high special interest in best vaccination protocols conferring protection against prevalent PCV2 strains. So when we start this history about PCV2 vaccination, we were facing PCV2A. Actually, all the vaccines are based PCV2A, but now we know that we have other PCV2 strains moving around. So there is special interest if the current vaccines are able to protect against these new strains. What we know about strains here in the United States, we know that we have the PCV2A. It was the most prevalent at the beginning of PCV2 vaccination 10 years ago, and we knew that we had a switch from PCV2A to PCV2B around 2008 until 2012, something like that. And recently, from 2013-14 until now, we know that the most prevalent is PCV2D, what we used to call PCV2B. So the mutant PCV2B, and now we have this new name that is PCV2D. So in other words, at this point, the most prevalent is PCV2D. We're still finding some PCV2B. We're still finding some very slow and very low proportion PCV2A. But those are the viruses that they are moving around, and those are the viruses producing this field exposure. The other one here is in the top of the dendrogram, we have PCV2E. It was documented by University of Minnesota, and there was some speculation about if that was kind of a new strain. No, actually, we learned from University of Minnesota that PCV2E is actually an ancestor of the other three PCV2s. So, in other words, yeah, it's been, there is a mutation, modification, but in a very low rate. If we compare this to RNA virus, yeah, this is very, very low. But if we compare with other DNA, yeah, maybe we want to have a little bit more mutation. But at this point, it's what we have in the field. 1 year ago, we present here in this in this seminar. Dr. Brian Payne presented this study. What we did is it was a massive sequencing study in all the United States. So we covered 28 farms, 10 systems, 5 different states where there is a lot of swine production. And the inclusion criteria for this study is to involve systems where they have this vaccination with full dose of Circoflex. They were satisfied with vaccines in performance, minimum expectation, and also no clinical signs. So we got successful Circoflex cases. And so we went to these 48 farms, about more than 600 samples. And at the end of the day, what we got is 40 sequences. So we have these 40 sequences, 40 different PCV2s in these successfully vaccinated cases of farms where we try to identify. Why we did this? By the nature of the virus, we know that even though it's under control, you're going to still be able to identify the virus in those populations. What we found is PCV2, all the three, PCV2A, PCV2B, and PCV2D. So we have this dendrogram, we call the successful vaccinated dendrogram. And so we got this information that we we have these good results of the vaccination, even facing this PCV2D. The goal for this study, so we decided to go ahead in this and do a field study comparing the one-dose protocol versus two-dose protocol. So the goal for this one was to measure the comparative efficacy of flex combo one dose and circumvent in rodent pigs. The primary parameter that we were measuring was average daily gain and mortality and culling, and the secondary one it was site reaction and inflammation following vaccination. The study design was very simple. So we have 704 animals distributed in these three treatments. Treatment one is flex combo, 331 animals, full dose at weaning, about 21 days of age, 2 ml, one dose, intramuscular. And treatment two, it was circumvent PCVM-G2, 333 animals, one dose at weaning, and second dose 21 days later. So 1 ml 2 times, intramuscular. We have the non-vaccinated control, only 40 animals, and we use these animals just for diagnostics. So we didn't include these animals in average daily gain and other measurements. It's just to have a nice picture of the dynamic inflection of PCV2. We focus on PCV2, but as you can see, we use a combination protocol. So we have mycoplasma and PCV2 in both treatments, but we focus on this study with PCV2. The calendar on sampling, it was on day 1, we have treatment allocation and everybody was ready. On day 7, we measured vaccination reaction. On day 21, the second dose treatment group. In day 28, vaccine reaction second assessment. Day 71, individual weight to start collecting all the data about average daily gain. And day 154, individual weight of the test. So we finalized this study, so it was the last time we weighed those animals. So with the 40 non-vaccinated sentinels, we did this serial bleeding in 0, 21, 50, 113, 154. Just to have, as I mentioned before, just to have a picture of the dynamic infection. And also to prove exposure, field exposure. Serum was tested by PCV2 PCR, Pierce ELISA, and mycoplasma pneumoniae IDEX ELISA. Okay, before showing the results, I'm going to mention what happened with the diagnostic of the sentinels, the non-vaccinated animals. We have PCV2 viremia in the non-vaccinated animals, 113, 153. So it was kind of a delayed exposure. And molecular characterization indicated PCV2D infection. We have previous history of the farm with PCV2D, but in this study it was very important to confirm this. So we have this late Pierce challenge in addition on top of this PCV2 infection on trial day 153 by PCR and ELISA. And we sequenced the virus, so we identified 174. So it was a co-infection, PCV2 and 174. It was very late, the Pierce infection, but it was there. No influenza seroconversion and no mycoplasma seroconversion. We understand that the system was stable, so it was positive but stable, but we didn't see high seroconversion. So it was PCV2 infection plus Pierce. We didn't find influenza, we didn't find mycoplasma, and for sure we have as a secondary bacteria other respiratory bacteria. This is the dendrogram. Here in the arrow, we saw this isolate, so this strain, the PCV2 strain that we are talking about, and we put it in that dendrogram that we did 1 year ago in these successful cases. Matched perfectly in the PCV2D cluster. So, okay, results. Let's go with growth performance by vaccine treatment. Here we have day 153. We have slightly numerical difference in favor of treatment 1. but we didn't see a significant difference. So there is no significant difference when we weigh those animals 150 days. And when we put together average daily gain and day zero from day 0 to 153, yeah, it's the same. There is no significant difference in average daily gain between these 1-dose protocols and 2-dose protocols. When we look at mortality, we have this mortality rate in day 0 to 153. So 5%, 5.14 versus 5.11. So no difference, no significant difference in mortality and culling. And on day 153 cull rate, so the same pattern. So no significant difference. So no difference in average daily gains and no difference in mortality and culling rate. Remember, I mentioned that the second goal for this study was to measure injection site reaction. So here we have on day 26 and day 6, after the first vaccination, we didn't see any reaction in any of the treatments. But in day 28, that it was 7 days after the second vaccination of treatment 2, we saw a significant difference. We saw more lesions in treatment 2, the 2-dose protocols compared to the 1-dose protocol. So as a summary, we can say that it's very important to do these kind of studies in the field and to try to have a picture of the current situation in terms of field challenge. So this is a PCV2D field exposure. We covered that with the molecular biology. And also on the top, we have this Pierce 174 co-infection. This is important because we understand that when we do these field studies, we try to mimic what's going on in the field. And in the last 1 year or 2 years, 174 infection in the field is kind of common situation here in the United States. No significant difference in growth performance, as I mentioned and show you, between these 2 treatments, 1 dose versus 2 doses. Not significant difference as well in mortality and culling rates between the 2 treatment groups. And significantly greater injection site swelling in the 2-dose protocol on day 28. These results are in agreement with previous studies. The only difference with this study is the PCV2D field infection pressure. So, conclusion is no efficacy difference between these 2 vaccinations, 1 dose versus 2 doses. These 2 different protocols, Circumflex versus Circumvent G2. So no difference were documented in this study. And this was under PCV2D field natural challenge and Pierce co-infection. And I would like to finish saying that one of the most important things that also we are sure that we are having this good protection and we have this cross protection is because we are in this kind of studies, we are 100% sure about vaccination compliance. So vaccination compliance is very important. It's very important for any kind of vaccination protocols, but it's even more important for 1-dose protocols.